welcome to another episode of the Senior Focus. I'm here with Kristine, Binette, and Jamie Kelly from Millbury Healthcare Center, and we're going to talk about the heart of the matter, a symposium that is on June 20th at Holy Cross at the Hogan Center. And like I oftentimes say, knowledge is power. The more that a person knows about something, the better off they are. In these particular instances, when we host symposiums, we talk about health issues, issues that concern predominantly the senior population. They can, affect everyone, but predominantly, I think seniors are affected by these issues. And I always, think that for a person to be proactive and to know and to learn about these things only helps them and benefits them. And I know that you guys feel the same way.
Yes, absolutely.
Tell me about Millbury Healthcare Center. What is Millbury Healthcare Center?
Millbury Healthcare Center is a 154-bed skilled nursing facility located in Millbury, but we're right over the Worcester line and very close to Shrewsbury and Route 146 and all the major routes. We have long-term care, 47-bed unit, and we also have a dementia unit, which is a secured unit that has 60 beds. And we have a big rehab program, and that's also a 47-bed program, and that makes up the 154 beds.
So when you say long-term care, I bet you a lot of people out there don't know specifically what is meant by long-term care facility.
Correct.
Can you tell us?
Sure. Our long-term care residents live at our facility, so that is their home, and we have activities and programs that are tailored towards those patients. And we also have a rehab program, and those are for patients that have a discharge plan to return home after suffering a heart attack or some other issue like a stroke or something like that.
So whether it's long-term or whether it's short-term, at Millbury Healthcare Center, residencies provided. People go there to convalesce from whatever ails them. In this instance, we're going to talk about cardiovascular disease, heart disease, and stroke.
Yes.
Maybe you can take turns and tell us a little bit about yourselves.
Sure. Well, my name's Kristine, Binette, and I'm the administrator at Millbury Healthcare Center. I've been there for just under 2 years now, and I've really enjoyed my time. My background is in occupational therapy, and I think that's what has drawn me to Millbury Healthcare Center with all of its rehab programs. I became interested in occupational therapy because I had a grandfather who had a severe stroke when I was pretty young, and I admired the therapist that I saw working with him to get him to recuperate. So that's how I got into the business.
So the experiences that you had with a loved one that had suffered a stroke, particularly draws your interest to the field of healthcare. Is that correct?
Yes, yes.
Yeah. What about you, Jamie?
Well, my background is social work, and I had originally started with the teenage population, girls, and I had worked for 4 or 5 years in a residential treatment center for teenage girls. And there was one woman, actually, she's out of the Leicester area, she worked there as well, had said to me one day, "Have you ever thought of working with the elderly?" And I said, not really, but as she had said that to me, I had thought and remembered, I adore elder people, and I find that wherever I am, whatever situation, I feel as if every time I turn around, I'm helping or bumping into or somehow connecting to an elder person who I hadn't known. And that kept with me for another year or so. I noticed that I'm surrounded by elder people. I love elder people. I love history. And so when my experience was going to be ending at the residential treatment center, I heeded her thought or advice or recommendation that I should perhaps think about working with the elderly, and I did. And that
lo and
was
behold, you find yourself at Millbury Healthcare Center.
27 years ago. But I've been at Millbury Healthcare Center for about 3.5 years. And I must say, with reference to being an advocate for the elderly, working at Millbury Healthcare Center, what's important to me after, like I said, good 27 years in this business, that feeling of respect, integrity that is given, cared for by workers, by people who work as a team, is of the utmost importance to me, because I'm in the field representing Millbury Healthcare Center, and I would have a very difficult time if, in fact, I didn't feel as if that weren't happening.
Right.
So that's my
like
background.
I say, like I've said before, like I'll say again, like I say all the time, knowledge is power. It's really important for there to be some kind of an outreach program so that people that need the information have access to the information. I think it's incumbent upon them when they hear of an event, and this is a free event, doesn't cost anyone anything. They can come, they can find out all about cardiovascular disease, having a stroke and stroke prevention, that they in fact do so, that they take advantage of the opportunity to equip themselves with the information and to find things out. So as far as if I were to ask you a specific instance, it's with this person who suggested that, have you thought about becoming involved with the elderly population, with the senior population? And I think at this point I want to say also that the numbers of seniors in the senior population is basically exploding. I think in central Massachusetts at this particular time we're probably running about 18, maybe 19% of the population being over the age of 65 years of age, and over time, maybe another 20, 25 years, I think is going to top out at about 1/3. So there are a lot of seniors that are either 65 years old or will shortly be 65 years of age because of the baby boom generation.
Correct. Right.
Is there anything in particular that got you interested in the Heart of the Matter Symposium? And we'll talk about that in a moment, but is there something specific that you can tell us and our viewers that interested you about this particular symposium?
Yes.
We were very interested in this symposium because we want to be a resource to our community and the folks that we serve. And as we know, heart disease affects over 5 million people, and every year there are about 500,000 cases or more diagnosed, and it is the leading cause of hospitalization for people that are over 65. So we want to be able to share our information about the programs that we have and how we can help our community.
So I feel like I can be comfortable in saying that this heart disease and cardiovascular disease, stroke and stroke prevention, it really is something that affects the elderly population.
Yes, it does.
Very much.
Yes.
And this particular symposium is a free event. Like we said, it's at Holy Cross College, and people can attend at no charge and obtain information on cardiovascular disease, on heart disease, stroke and stroke prevention. And like I say, the reason that they go is to be able to get the information that they might need to help them with the transition later in life. As an attorney, I always try to convince people, the sooner you get information, the better. If you try to, react to a situation under a stressful time, it becomes very, very difficult, and whatever transition might be necessary down the road becomes exceedingly difficult. And this particular symposium is an opportunity for people to get that information, hopefully at a time before there's a crisis. If someone were to come and they're interested in obtaining information, you'll have a booth at the symposium, won't you?
Yes.
Oh, yes.
And what kind of information might someone get by attending and visiting your booth?
Well, part of the information that they would receive having to do with a cardiac condition would be some of the programming that happens or could happen at Millbury Healthcare Center, depending on what their condition and where they came from. Knowing that we have credentialed staff that have gone through extensive training, that we have physicians, our medical director, we have directors of cardiac program a protocol so that if you were to come to the booth and understand, okay, if I had a heart condition and I ended up at a particular hospital and needed some type of rehabilitation prior to my going home, what could you offer me?
Right.
And that's the information that we would be able to
And
extend.
you mentioned the cardiac program.
Correct.
Can you tell me a little about the cardiac program?
Sure. We have, we call it a heart failure program that we have, and what we've done is we've trained all of our nursing staff and our therapy staff, so there are specific protocols that are followed, and the protocols were given to us by the physicians at the hospitals that we work with. And the program contains a lot of training for patients that come to us, training on diet, for instance, and we have a dietitian that will work with them, knowing to monitor their weight every day to make sure that that's stable, and medication teaching, because a lot of times a patient may go home and have difficulty with their medications. We want them to be able to know the signs and symptoms if something's not going right. We really want to prepare folks so that when they go home, it's a good transition back to home and they have all the information that they need. So we do a lot of patient education, and the heart failure program is just one of the number of programs that we have to offer.
I have a question for you. I don't know if you can answer it, but there was a bit of a dichotomy or a dispute or what you will between myself and another staff person in the office I work in, and the question came whether someone with congestive heart failure, whether the heart tissue itself is a healthy heart tissue or not. I was of the impression that someone has congestive heart failure, then there is a diseased process in the heart. Do you know? Who would you side with?
You're talking to two non-nurses.
Two non-nurses. However, go ahead.
Your theory sounds good, though.
Yes, it does.
Do we have any idea whether you're going to provide raffles at the symposium?
Yes.
We will be providing a raffle, and we will have a nurse also at the booth that can take anybody's blood pressure that would like to have it taken, and we'll have some educational materials as well.
And at the symposium, and everything's free, doesn't cost anyone anything, so someone's able to go there, like I said, get information. Registration is required. Again, once again, as I've said a billion times, I'll say it again, doesn't cost anything, so someone is able to go get information. In the event someone wanted to register, phone number to call is 508-755-6525 to register for the event. Once a person's registered for the event, they will end up going on June 20th. Like you had indicated, I think you indicated, it begins at 8:30 in the morning with registration. They register, then they go into the event. The first presentation begins at 9 o'clock sharp. I don't know if you have any familiarity with Dr. Phillips or Dr. Muniz. Wonderful physicians from UMass, and Dr. Phillips will be providing the keynote, and the keynote is called Affairs of the Heart, Advances in the Diagnosis and Treatment of Cardiovascular Disease. I mean, I've had these physicians on my programs before, and I mean, there really is tremendous advances in the treatment and in the diagnosis of whether it's heart disease, whether it's cancer, whether it's something with your liver, whatever the case might be. And I don't think people realize that there are actual screenings that are available. But in any event, I think we're going to have to head to a break right now. When we come back, we'll have more Senior Focus for you.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step. returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Please join us on Wednesday, June 20th at the College of the Holy Cross for a special day for anyone interested in learning more about the latest information on heart health. Admission and parking are free. There will also be a complimentary lunch buffet and raffle prizes. Register now by calling 508-755-6525 or by visiting www.edlalaw.com.
Charter Business helps businesses achieve everyday victories. Want to be victorious today? Call 877-BIZ-BUNDLE and switch to Charter Business Internet and phone for just $99 a month. You'll enjoy internet 6 times faster than standard DSL, plus unlimited long distance. Getting a business bundle for just $99 a month makes for an easy decision. But hurry, because this offer won't last. So call 877-BIZ-BUNDLE today. To the victor go the spoils!
Join me on the Hank Stoltz Experience. You know, people are always asking me, what is the experience? Well, that's the beauty of it. It's everything that has to do with Central Massachusetts. And just like Kelly Square, where the traffic never stops, we never stop either. There's no red lights on the Hank Stoltz Experience.
The weekend homicides mark the 5th and 6th for Worcester. Prosecutors say he is responsible for a violent armed robbery. An elderly woman is held at knife point. 32 men, all charged with possession or dissemination of child pornography. He was found eating his wife's flesh. Detectives are treating the incident as a suspicious death. A report of an infant in a car seat in the middle of the road. 250 gallons of the dangerous chemical. Melissa Tubin, Worcester News Tonight.
I'm Hank Stoltz. Join me on the Hank Stoltz Experience, and thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, Attorney Nick Kaltzis, and I'm here with Kristine Binette and Jamie Kelly. We were talking on the break, during the break, about the particular services that you offer, and you had mentioned about an EKG machine, and I thought maybe our viewers would like to hear what we were talking about, and you can elaborate on the EKG machine.
Actually, the CHF, or the congestive heart failure program that we have, the cardiac program, we often sit and look at our programs, how we can advance them, enhance them. And it came up that there was an old EKG machine in the storage closet. And it was actually a physician who said, you know, an EKG machine in a skilled nursing facility for our post-surgical patients, especially cardiac, would be of most benefit. And not that, I mean, we did dust it off, but we had purchased a new one. But the irony was that we had it, an older EKG machine that was still working, but it absolutely prompted us having a physician almost leap over the table saying, you know, an EKG machine for a skilled nursing facility is really quite unique, and the time that it would save for a patient that was perhaps experienced some irregular arrhythmias after surgery, which is a fairly normal event. Usually what would happen is, you know, the nurse would pick that up and you would have to send that patient in only to be set up with an EKG machine to get the reading that said, okay, this is a pretty normal irregular rhythm, but we can send back and or admit. So having had purchased an EKG machine for the SNF or the skilled nursing facility was something that, as we've gone around and spoken with different cardiac physicians, they kind of opened their eyes like, great, that's wonderful.
Yeah.
That, how nice not to have to be able to send that patient in that may be having what would be a normal reaction to post-surgery and or post-cardiac surgery. So you would think, wow, that's pretty nice that we were able to obtain and be able to offer that.
You were mentioning that there'd be a time savings because you can begin the process, earlier. And in fact, when Dr. Muniz was on our program a couple weeks ago, that's one of the items that he specifically mentioned, and I think he mentioned it more than one time, that time is of the essence.
Yes.
The longer a person is untreated, or the longer a delay occurs where they can bring treatment to bear, the more damage there is, and rapidity is the most important thing, which I suppose kind of falls right into line with my saying that a person shouldn't procrastinate. They should find out what information is available for them, arm themselves with that information, rather than procrastinate and wait for the last moment and then attempt to address a particular situation. It's a formula for disaster.
Yes.
And with the EKG machine that you're mentioning, I think it's a great benefit to the people in the facility, so that in the event something happens, they can be monitored.
Especially for the patients that live at our facility, our long-term residents. We found that the trauma of the transfer and just having to sit in an ER or wherever they are getting the EKG done, it takes a lot of time. They're very uncomfortable. They're with unfamiliar people. So we have used it quite a bit, not only with the heart failure program patients, but also with our long-term patients. So it's nice that they can stay at Millbury Healthcare Center and have this offered to them, and they don't have to go back to the hospital.
What if a patient had some kind of a surgical procedure in the hospital and the hospital says, I can't discharge you to go straight to your home. You need some kind of rehabilitative therapy, so that you can learn to cope before you go home. Are you equipped to handle that kind of situation?
Yes.
Yes, those are exactly the kinds of patients that we take at our rehab facility.
Okay.
We get lots of folks that have been in a car accident, or they've had a stroke or a heart attack or some sort of surgery. And those are the types of patients that would come to us before they would go home.
And what kind of things do you do for those people? Let's say that, I had a heart attack and the doctor says to me at the hospital, Nick, I'd love for you to go home, but I think it's a little bit too soon. You're not going to be able to go home right yet. But, go for rehab, go for rehabilitation, and they're going to teach you things, and you're going to recuperate, and when you're stronger, you'll be able to go to your home. If I were to show up in your facility, what kind of things might I expect that you do for me?
You would be evaluated by the treatment team, so you would have a physician that would be overseeing your care. You would also have the nurses do an assessment to make sure that your heart was functioning properly. They would take your vital signs and ask you some questions about what brought you to us. We would also get the information, obviously, from the hospital. We would want to know what medications you had been on. And then you would also be evaluated by physical therapy and occupational therapy. And for the folks that need it, we also have speech and language pathology, and we also have respiratory therapy. So you would be getting any of those therapies that you may need, depending upon your condition.
And I would assume that the speech and language therapy specifically geared for people who are suffering the effects of a stroke?
Yes.
Yes.
They also evaluate swallowing problems that a person may have after having a stroke, and also cognitive issues that a stroke patient may have.
So there's a really high level of care that they can receive if they have some kind of an episode, or like I said, the cardiovascular disease, heart disease, they suffer a stroke. They can be monitored closely at your facility.
Yes.
Correct. I also want to say that the cardiac physicians or most doctors, when sending a patient to Millbury Healthcare Center, we have opened up that communication where the medical director or the doctor on our team that is communicating with whomever has sent the patient to our facility. So we have opened up to the point where we have invited in many different physicians to let them see what our program entails. And we've also incorporated their suggestions to make our program a lot more, so it's comfortable for them.
Sure.
They've sent over, you know, a cardiac patient. They really want to. They care very much.
Yeah.
So it was great to have them be able to come on board, if you will, and be a part of putting together parts of this program that is quite extensive. And so it's been a collaboration, and the communication is key with reference to the doctors, nurses, back to the program, where they're going to be seeing the cardiologist after they have left the facility and going to see their appointment. We receive tremendous feedback about how wonderful the care has been while they had been at Millbury Healthcare Center.
And, you know, of course, I need to thank you for your participation and your sponsorship, because, you know, without the assistance and the generous contribution that we receive, wouldn't be possible for us to put this kind of symposium, this kind of thing on. A lot of people, you know, they hear symposium, they're not really quite certain what it means. It's like a seminar, it's like a workshop. Person can come, they can arm themselves with information. Tremendous physicians, whether it's Dr. Phillips, Dr. Muniz, Dr. McManus, Okini, Ennis. I will be presenting as well. I'm not a physician, and I'll have a very brief presentation, but you know, it's possible to learn so much from this. So, you know, I thank you for helping us get the information out there. But like I said, we've had a long-standing relationship, and it isn't just about heart disease, cardiovascular disease, stroke prevention, whether it's Alzheimer's disease, whether it's a cancer. Eventually we, in I think 2 or 3 months, I think in September, we're going to be providing a symposium on arthritis and joint replacement. There are other programs that are available at your facility as well, aren't there?
Yes.
Can you tell us a little bit about those?
More exciting to have developed, for instance, a Parkinson program, the only one in Central Mass at a skilled nursing facility with a physician, neurologist, movement disorder specialist. From that Parkinson program, we are developing a community wellness program within the facility to bring in the community of people with Parkinson's disease and or their loved ones, family members. A pulmonary program, a very extensive pulmonary program, again with a pulmonary program, a pulmonologist as a director, respiratory therapist. The Better Breathers Club is what is growing out of that pulmonary program at Millbury Healthcare Center. Christine, if you, I mean, we take a program and again, enhance it, and open it up so that the community can also be involved.
And when you say pulmonary, just in case someone doesn't quite understand, we're talking the lungs.
Yes.
Okay.
Yes.
How is it possible, or is it possible for an individual to distinguish their need for either long-term care as opposed to home care? Is it possible for someone to sit back and rationalize what kind of care they need, or is that the domain of the physician, and the physician is going to tell them what they need?
Coming from a social worker's point of view, oftentimes, you know, if you're going to ask the elder person, how are you making it at home? Oh, I'm fine. And you're able to cook, you're able to walk, oh, everything's wonderful. Oh. And then you see that they perhaps have had maybe 1, 2, 3 hospitalizations, maybe there's a visiting nurse in there, and then the family's involved, and the family now is starting to ask questions about how they really are able to function at home. Are they thriving, the word failure to thrive, or are they thriving? Being able to safely, and that would be the key word, to safely take care of themselves and or with the support services in hand or at their home. Oftentimes it's the physician that I would say as a social worker to the family, please use the physician with reference to how that physician feels your loved one is doing at home.
Well, we're going to get that word out in the segments to follow. I want to thank both Kristine, Binette, and Jamie Kelly for joining me today. And I think you'll join me in saying that the symposium is a very important event, and it's something that people should come and get information.
Absolutely.
Thank you. I appreciate you coming in today.
Thank you very much.
Thank you. Thank you for having
You're very
us.
welcome.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Please join us on Wednesday, June 20th at the College of the Holy Cross for a special day for anyone interested in learning more about the latest information on heart health. Admission and parking are free. There will also be a complimentary lunch buffet and raffle prizes. Register now by calling 508-755-6525 or by visiting www.edlalaw.com.
When we walk together, we are bigger than cancer. Join the world's biggest fight for more birthdays, the American Cancer Society Relay for Life. Find your community's event at relayforlife.org.
Charter Business helps businesses achieve everyday victories. Want to be victorious today? Call 877-BIZ-BUNDLE. Switch to Charter Business and start saving over $50 a month. You'll enjoy internet 6 times faster than standard DSL, plus phone with unlimited long distance. Saving your business over $50 a month makes for an easy decision. It's indecision that'll cost you. So call 877-BIZ-BUNDLE today. To the victor go the spoils.
We do 3 hours of mental health. I give everyone an opportunity to get everything off of their chest, to express themselves, get rid of all their frustration. And if you're really whacked out and off the wall, I even give you a chance to come on the air.
I'm Caitlin Tivnan from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, Nick Kaltsis, and I'm here with Janine Dackery and Karen Larson. Hello, ladies. How are you?
Good afternoon.
How are you?
Well, we're talking today about the heart of the matter and cardiovascular disease, heart disease, stroke and stroke prevention. And I suppose the first thing I should ask you is, can you tell me a little bit about Auburn VNA and what exactly is Auburn VNA?
Sure.
And I suppose I should let people know that you're both from Auburn VNA.
Yeah, sure. Well, first, let me just thank you for having us today. I really appreciate it.
Thank you for coming in.
And also thank you for the work that you're doing in educating the community.
You're very
That's
welcome.
great.
You're very welcome.
I thank you for that. Auburn VNA has been around a very long time, about 94 years, and we're a nonprofit agency. I think one of the things that people forget or maybe think about that's not true is that we're not just focused in Auburn. We cover a very large territory of Central Mass, so that we have services available throughout the community. And we offer our nursing services, therapy, social work, and We also have a wonderful adult day health program, Peckachug Gardens, and we provide private care. That's our Bancroft Private Care division as well. So,
now, when I think of, VNA, I think someone's at home and you bring services to the person. They don't have to necessarily come to your facility. They can be home and you go check up on the person, so to speak.
Correct.
That's absolutely correct. We offer a very broad range of services. Pretty much, I like to tell people that you can receive almost anything at home that you can receive in the hospital, with the exception of the major diagnostic procedures such as CAT scans, MRIs, things like that. But pretty much everything else, barring that, can be done in the home care setting. And people like to be at home because they're in a place that they're familiar with, they're more relaxed, they're more comfortable. I can't tell you, as a floor nurse in a hospital, all of my patients, the first thing they want to do is make me well enough so I can go home.
Right. Everyone wants
to be home where they can sleep in their own bed, use their own bathrooms, raid their own refrigerator, and we offer them a chance to do that.
They're just more comfortable in
Absolutely.
their own.
And when you're
I know I'd be
comfortable,
more comfortable
your body
in my own.
heals better because it's more
Sure.
relaxed. It's a whole process, which is very nice.
I mean, I've been practicing for more than 25 years now, and I might have seen one or two people that didn't want to be in their home anymore. They wanted to go into a nursing home, that they didn't want to be home. They wanted some kind of care, not in their home. But the overwhelming majority of people that I know anyways want to be able to age in place. They don't want to leave their home. They want to stay in their homes.
Absolutely.
Yes.
That's very true.
You are clinical coordinator.
Yes.
Okay, so it's a big term. I'm not quite certain what that means. What do you do?
Well, my job as the clinical coordinator / manager, I am in charge of the nurses that work for us. I have a co-manager, Jen, who runs the therapies, the physical therapist, occupational therapy. We have speech and language pathology. We have a social service system. We also have home care aides. So we have a very broad range, but I manage the basic skill of nursing.
And Janine, can you tell us a little bit about yourself? You are the Director of Hospice Services, is that correct?
I am, yes.
Okay.
Right now, I'm here representing our management team. I'm in the process of putting our hospice program together. So that will be something that we'll offer in the future.
Trying to maintain a person's quality of life
Yes.
for as long as they live.
Yes, and again, at
Which
home,
is very,
you know.
very important.
It
I
is.
mean, tremendously important.
Yes, and we hear all the time from people, whether seniors or not, that as you mentioned earlier, they want to be home.
Right.
They want to be cared for at home. They want their family around them. And so we do everything we can to make sure that happens and provide them with anything that they need.
You know, I'm a strong proponent of the more knowledge someone has, knowledge is power. I say it over and over. And the symposium, the Heart of the Matter Symposium, is just that. It's an opportunity, like I said before in the program, for someone to come and obtain the information necessary so that whatever transition they're facing, they're involved in, or that might be coming, in the future, they can handle it as graciously and as easily as possible. A lot of people don't get any information until it's a crisis. It's a crisis-driven society, right? That makes whatever transition necessary that much more difficult.
And I've heard you say a few times that knowledge, is power, and I agree. I was at the first symposium, which was wonderful. I thought it was well attended.
Thank you.
And I loved so many people coming up and wanting to know everything. What can you tell me?
Right.
They had great questions. I think the days are gone when, elders just listen to what the physician tells them to do. Now they want to know.
Yeah,
Tell me.
That's a really good thing that they should want to know, because I've also said many times on the air that what do people refer to the senior population as? The silent majority. They don't, or they're not proactive in determining what their answers are to their questions. They'll just sit back and take the information that's given to them. But I think it's far more effective for them if they have a concern or a question or an issue that they want to look at, go out and get the information. With the Heart of the Matter, and once again I have to thank Auburn VNA for its gracious support, because you help us bring that information to people. And it's incumbent upon them to be proactive and go out there and find out the answers to the questions that they might have. If I were attending the symposium as whether it's a patient that's suffering cardiovascular disease or maybe a caretaker of someone who's suffered a stroke and is recovering from stroke, I presume you'll have a booth there.
Yes, we will.
And if I went to the booth to get information, what kind of information am I going to get there?
Well, we have lots of information on prevention is a very, very big thing. You've said knowledge is power, so that includes education, 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 and prevention of some of the steps to take prior to the big event where you have to have a heart attack, you end up in a hospital. What can we do to teach you? We also have a lovely, what they call a telehealth system in place, which is where we place a blood pressure monitor, a scale, an oxygen sensor in the patient's home, and our nurses go out and we train the patients to check their weights every day. They put on the blood pressure cuff, they check their oxygen levels. This information gets transmitted to a data center, which now interfaces. We've also upgraded all of our equipment, so we now have our telehealth equipment interfaces with our computer software in a large database where some of the physicians are actually jumping on board with us as well. All that information goes right to your doctor, which is a very, very nice feature. And we're finding out that with these key pieces in place, we can actually prevent a lot of hospitalizations by catching things early on rather than waiting until we get that fatal call.
You know, it's spoken like a true person involved in the medical field, because I can tell you that whenever we have physicians or surgeons that are on the air with us, most of what they talk about is screening and prevention. And I don't recall exactly the way Dr. Muniz put it, but he was like, you know, he was trying to indicate that, you know, preventing an occurrence is so far superior than treating it once it has happened. And there are screenings that are available, but you know, people don't take advantage of it. And for instance, with this telehealth that you're mentioning, you know, a product of technology.
Absolutely.
Tremendously valuable. I don't know that people understand just how valuable and helpful that can be. And maybe a lot of people would shy away from it because they think, oh, technological advancements. But as far as the technology that's required, isn't really required from the patient. It's probably very, very simple for the patient to do whatever needs to be done for the information to be, you know, we'll say telephonically communicated or you know, communicated to the physician.
Correct.
So if someone's sitting at home and they're involved in this telehealth program, what kind of things would they do?
The system is prompted to set up a time, usually in the morning when the patient gets out of bed. It asks you, are you ready to do your self-check today? It asks the patient a series of questions. Is your breathing okay? Are you having trouble breathing? Are you feeling lightheaded? And the patient answers the questions with a touch screen. It checks their blood pressure. It asks them, okay, now you're going to get on the scale. It takes their weight, and all those numbers, answers to questions, gets transmitted for us.
So they're
for the patient,
basically guided through the whole thing.
It's a very, very user-friendly, yes it is, thank you, a very user-friendly step-by-step process. It asks you a question, gives you plenty of time to answer, and based on the patient responses, we have someone in the office that reads that information every day. And if we notice a patient who has congestive heart failure per se, their weights are very important to trend. And if we see an increase, patients also reporting a little shortness of breath, we can send a nurse out right away.
You know, that's incredibly valuable to people.
It absolutely is.
I can recall a show that we had with Dr. Craig Lilly at UMass. He's a physician at UMass, and they had begun instituting a similar kind of program where they put, whether it's a monitor, like a TV monitor, so they can actually see the person and the complexion of the person, and they can monitor the blood pressure and the respiratory activity. This is the same kind of thing. A person doesn't have to be in a hospital to take advantage of this kind of.
That's correct. Right. Very well said. And what makes this nice is that this is really good for someone who is frail and cannot get out. This allows us to keep track of them without having to worry about how am I going to get to my doctor, how is my blood pressure going to be checked, how am I going to manage. Well, you have nurses in place to teach, help manage medication. You have this wonderful telehealth system that allows us to track your vital signs for you.
We're going to head to a break right now.
Okay.
When we come back, we're going to talk more about the heart of the matter.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Please join us on Wednesday, June 20th at the College of the Holy Cross for a special day for anyone interested in learning more about the latest information on heart health. Admission and parking are free. There will also be a complimentary lunch buffet and raffle prizes. Register now by calling 508-755-6525 or by visiting www.edlalaw.com.
Help the American Cancer Society save lives and create more birthdays by joining the Relay for Life of Worcester, sponsored locally by Charter Communications and Charter TV3. Relay is a unique community overnight event that allows teams of families, friends, and co-workers to join together in the fight against cancer. Form a Relay team this year and make a difference. There are 14 relays taking place throughout Central Mass this year. For more information on a Relay event in your area, visit cancer.org and register your team today.
I'm Tom O'Donnell, Chief of Police for the town of West Brookfield, with an important safety message. Studies have proven that texting while driving is dangerous and has led to fatalities. Is taking your eyes off the road to read or respond to that text message worth the risk of getting into a car accident or worse? Be smart behind the wheel, not only for your safety, but the safety of others. This safe driving message is brought to you by the Central Massachusetts Chiefs of Police Association and Charter Communications.
Join me on the Hank Stoltz Experience. You know, people are always asking me, what is the experience? Well, that's the beauty of it. It's everything that has to do with Central Massachusetts. And just like Kelly Square, where the traffic never stops, we never stop either. There's no red lights on the Hank Stoltz Experience.
I'm Kristine Doucette from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. Again, my name is Attorney Nick Holsis, host of the Senior Focus. I'm here with Janine Dacry and Karen Larson, both from Auburn, VNA. We've had a lot of interaction. The help that you've given us is really very important and helps get information out because, as I've said time and time again, you know, knowledge is power. The more someone knows, the better off they are. In my practice as an old law attorney, I try to inform people of whether it's, you know, basic estate planning, trust-based estate planning, Medicaid planning. Oftentimes people wait until a crisis occurs. You know, it's a crisis-driven society, right? They wait till the very last moment. Then they seek some kind of redress to their issues. This kind of a symposium brings the information, makes information available to people, and all they have to do is attend. Doesn't cost them anything. It's a free event. It lasts the entire day. Starts at, what, 8:30 in the morning? Goes until about 3 in the afternoon. There's free lunch included. The parking is complimentary. The entire day doesn't cost anything. in the event someone's interested in finding out more about the event or registering for the event, the number to call is 508-755-6525. And of course, you can also visit the website of Elder and Disability Law Advocates to register for the event. And the website address is www.edlalaw.com, and a person is able to attend the event and obtain whatever information they need that's helpful to them. I was on the radio on Monday, and they got a caller, and the caller didn't know what a symposium was. And you know, she was a very nice elderly lady, and she called and she said, well, you know, you're talking about symposium, but I'm not really quite sure, what's a symposium? When you hear a symposium, what do you think?
Well, I can understand that. I'm sure many of them think, I can't go to that. This may be some very...
and it's sad that they think they can't go to it because
right.
it's specifically
for them. Yeah, I mean, for me, yes, I'm used to that. It's an educational event, it's a seminar, it's an,
like a
workshop, someplace to learn lots of information. So you're right, it is exactly the people that should be there, and it is for them. And you know, the one that I attended, I think what for me was so good about it, it encompasses so much information.
Did you attend at the Beechwood Hotel or at Holy Cross
At
College?
Holy Cross.
Yeah, Holy Cross College has more space, more people can attend. It's a more open environment, so people
easy to
aren't
find.
cramped in.
Yes.
I'll tell you, their lunch is wonderful. I mean, you know, I was surprised at just how good the lunch was, to be honest with you. You know, the parking is right outside the building. It's not like you have to park far away and it's a trek to get, you know, into the symposium. It's literally right there. Walk up the stairs, go into the building, and you're there.
And not only do you have speakers who offer so much, but all of the vendors, and you can walk around and really gather so much information and have questions answered that maybe you couldn't ask before.
You know, I think that one of the most important things or informational you know, opportunities that a person would have is to find out what's available in the community. If they're ill, if a spouse is ill, or you know, they're an adult child and they're a caretaker for a mother or father, and you know, that person has a particular ailment, what particular services are available to help the person stay at home? Everyone wants to stay at home.
Of course.
Maybe sometimes a person's not able to, but while they're able to, everybody wants to stay in their home. Is there anything, any light that you can shed on whether a person is no longer safely able to stay in the home? How can someone draw a distinction, or is it even, you know, their call whether it's safe for them to be in their home?
I think for patients, because many of the referrals that we get are from hospitals or from physicians, and with case managers or social workers in the hospital working with the physicians and the families as well to decide, you know, can this person go home? And you know, so. And then for us as an agency to go out, and again, you know, Auburn VNA Health Network, we're able to provide so many services. So we would go out and do an assessment, you know, of a patient, and maybe they came on because they had an attack and they needed some help at home, and so we would go out and assess that, and then maybe they'd get the telehealth monitor to help them. Maybe we'd also find out once we got out there that they may be a great candidate for adult day health. Maybe they could spend a few days there.
One of the other things I found in my practice is that people are so fearful that if they bring help into their homes, that the people that they bring into their homes to help them are actually going to take them and put them in a long-term care facility, which is, nothing can be farther from the truth.
I hear it all the time.
That
Yes.
is the reason that so many people end up in a long-term care facility, in my opinion, is because when they need help, when they need the assistance of other people, they're afraid to go out and get it, and their health deteriorates. And perhaps then it's no longer safe for them to be in their home, and had they gone out earlier and gotten whatever assistance they required, whatever they needed, and brought that help into their home, for instance, with the telehealth program, it's able for you as quickly as possible to service that person's medical needs so that their health doesn't deteriorate to the point where it's not safe for them to be in their home anymore.
Well said.
Is there anything in particular, and I might have already asked this, and if I did, excuse me and tell me that I did, is there anything in particular that specifically drew your interest and your attention to healthcare?
Me personally, I have a family full of healthcare professionals.
Okay.
My aunt is a nurse, my grandmother was a nurse's aide, my best friend's mother was a nurse, so I was surrounded by healthcare professionals as I grew up, so that was where my interest lay. Just from a very young child, I was exposed to it, and it seemed like a very good thing to help people and always be involved in helping folks get better.
And you mentioned that you had some history working in a hospital, I think you said?
I do, yes.
And how long have you been doing this kind of thing?
Home care specifically? Since 1998. So a long time.
A number of years,
Quite
yeah.
a while, yes.
And before the home care?
I worked at St. Vincent Hospital in the float pool.
Another wonderful hospital.
Yes, sir.
A wonderful hospital. And Jean, how about you?
I've been a nurse for almost 30 years. Pretty much split. My first half of my career was as an oncology nurse at St. Vincent's, and then right now, since then, I'm involved in hospice care, which
yeah, I can tell you that St. Vincent's Hospital has been very helpful in helping us get the word out for the symposium, and I think they also recognize the value in providing information for people. There are free CEUs that are available for both nurses and for social workers. So the ability for even professionals to come and to learn from the event is there. It's something that they should take advantage of. And these particular physicians, will provide a first-rate presentation. I want to thank you both and Auburn VNA for providing the donation, the sponsorship necessary to help us bring this information to the public, because really without the assistance of the vendors and the sponsors, we wouldn't be able to do it. So in any event, thank you for coming in today.
You're very welcome. Thank you for having us.
You're very welcome.
Yeah, thanks.